Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on what is a beautiful Monday morning in spring before the snow arrives tomorrow. Oh, man, that just chills me to the bone. Hey, we are back broadcasting live with you from the Dulce Simons Family Studio here at the University of Kansas Health System, and delighted to be with you today. We have some pretty cool people here with us this morning. We have Vanessa. Okay, Vanessa, help me with your last name. It's Goldsberry, right? Did I say it correctly?
That's
okay,
correct, yes.
That's going to be awesome. You are our Director of Volunteer Services. She's joining us here in the studio. She's also brought along a volunteer, Elaine Struve. Did I say it right?
Struve.
Struve. Okay, I was close. That's not bad for me and all my speech stumbles. You know, when COVID-19 hit hospitals, it changed volunteering altogether, and in some ways, because the volunteers couldn't even come back into the hospital, and that's been a loss for all of us. But as our vaccine clinics opened, the opportunities to volunteer accelerated. We're going to hear that story. But first, Hawkeye, how are we doing?
The numbers are pretty good.
Not bad.
They're going in the right direction. Because at the end of last week, they were going in the wrong direction.
They were going a little bit in the wrong direction. Not like what we've experienced back in the fall, but yeah.
But considering what's going on around the nation and other parts of the world, it certainly is concerning. But today, 8 active infections, but 6 of those in the ICU and 3 on the ventilator. Still 9 in that recovery period, so 17 total patients, which I think we're pretty happy with. Hayes has 4 with 3 active infections and 1 in that recovery period as well.
So just to say, some pretty interesting vaccine news over the weekend. If you take Americans 18 and older, over half have had their first shot.
Yeah.
And despite the J&J vaccine, and it may just be there's a little question about when people got asked the question and all this stuff on the survey, but vaccine hesitancy may be declining in the United States. That would be great news.
I think that's good news. I think if we take a little bit of cue from Israel, which we know that they're
more data published just recently.
It's looking really good. So if we can get more people to get vaccinated, and again, we had a question I think a week ago about population immunity or herd immunity and the lack of being able to understand that kids are able to be vaccinated. So certainly just down to 16. But we really need, once we are able to get the data, and if it shows it's safe and efficacious, really get everybody vaccinated regardless of age, because that is the way that we are going to be able to get out of this pandemic, get back to the K, get back to Arrowhead in those large crowds and stadiums. And vaccination continues to show in real world experience that that's the way that we can do it.
And just to say, Royals, great weekend, Sporting, great weekend. There may be no louder place on earth with more shouting going on than the Cauldron at Children's Park. So just a couple of quick thoughts about the Israeli data. Man, society can really reopen more and more when people are vaccinated.
Yeah, they're starting to lift restrictions and mandates now. So obviously they have a smaller population, a smaller geographic area. But I think as a culture, a medical or vaccine culture, they are all aligned. And we can see that they are keeping themselves healthy. They are not running into capacity issues. We know that, unfortunately, India is going through major capacity issues with just the ability to deliver oxygen to people who need it in the hospital. So if we can continue to do that, reduce vaccine hesitancy, and get more and more people vaccinated, we can definitely be in a healthier place in these next couple months for sure.
You know, there was at one point in the height of the crisis back in late November, early December, where we were having difficulty finding oxygen to discharge people home with. So it can happen here as well. What we do know is that I think the success of our vaccination program now, with a lot of vaccine available, is beginning to show effect. Still, the hesitancy amongst those who tend to be more conservative is much greater than those who tend to be lean Democratic. And just remember, SARS-CoV-2 really doesn't care which party you're in. It doesn't care what set of political beliefs you have. It doesn't care which religion you are. It doesn't care what your ethnic or racial history is. SARS-CoV-2 just wants to find a host, and it'll find a host in all of you. So that everybody needs to be vaccinated in order to stay safe.
Yeah.
So the other interesting thing, looking at the J&J information as well as what's coming out about the AstraZeneca vaccine, it looks like we've identified the culprit, this one part of our inflammatory cycle and thrombotic cycle that's causing the problems related to clot for both AstraZeneca and J&J.
Yeah, I mean, we are getting closer. We have, we have to believe there is some sort of similarity between these because they are both those adenovirus vectors, and we're identifying, even better is to identify the further risk factors, the diagnosis of it, and then, of course, the treatment to reduce and stop those fatal outcomes.
Yeah, and the treatment we know looks like it's pretty effective for it, so that's really good news.
Yeah.
The last thing I just point out before we go to questions from reporters is that Dr. Fauci hinted pretty, maybe even almost just outright said over the weekend that barring any strange new news, he expects the J&J vaccine to be reopened again on Friday.
Mm-hmm.
And I think that's likely good news.
Yeah.
It can carry some warnings or restrictions or some advice, et cetera. But both that and the AstraZeneca vaccine are really meant for the entire world. We really need to get those going.
You know, I think that's the key point. And I think having warnings or restrictions or subpopulations that we use or don't use it in, that's nothing new in medicine. We do that every day with different drugs, different vaccines. So I think that's good. And just like you said, I think the point is those are the vaccines for the world because they can be shipped to these other places. They can be transported. They're just one dose. Well, for Johnson & Johnson, one dose. So I think that is important for the rest of the world.
And just to say again with vaccination, you mentioned that the rotavirus vaccine can cause intussusception, which is a type of obstruction of your bowel, in children in a very rare instance. So do you stop using it in places where rotavirus is a public health threat because of the lack of support services for health care or medical care for young infants? And I think the answer is no. People still get it because it can be such a threat to life overall, not unlike what we see with SARS-CoV-2. All right, Jill, let's see what questions are out there from reporters this morning.
Good morning. It's Dan from Channel 41. I was wondering about the Johnson & Johnson vaccine as it relates to folks who already have blood issues. Is there any concern on your end about folks who have sickle cell or thyroid issues in their family history as it relates to the clotting that we've seen with Johnson & Johnson moving forward?
Dan, that's a great question. What I know so far is that by and large, it appears to be in young women, especially in those who are on birth control pills, which can cause a thrombotic tendency anyway. However, it's been in some older folks as well. So we won't know, I think, the full answer to that question, Hawk, until after we get more information on Friday when the CDC releases some more of that data. If you look at the New England Journal of Medicine article last week, though, where there was information presented about the cause-effect relationship, I'm going to guess that this is pretty specific to people who have other types of potential prothrombotic states. I'm not sure that I would have said that about thyroid disease, or it may be true about sickle cell, but we'll have to. I think, Hawk, I wait for more information.
Yeah, I mean, right now there just is so little out there about it, but a family history of sickle cell or thyroid disease, I don't anticipate will be one of those risk factors. But again, so few cases. With the Johnson & Johnson vaccine, I think we really just need to kind of wait and see what the information is that comes out. I think all these questions are something that should be investigated for sure.
You know, one point to be made, 2 points. First of all, tomorrow, Jill McGurk, who's the director of the bone marrow transplant program here at KU, we'll ask him that question. So, Dad, you got to tune in tomorrow. Remind me, I'll look at Jill. We're going to remember to ask Dr. McGurk that question because he may have a more in-depth answer than I can give. But secondly, the point about more information on Friday. What happened in a lot of these cerebral venous thrombosis, which is unusual because the rate of thrombotic events overall in the vaccine population does not appear to be higher than what it is that can be generally occur. It's like saying, I got a vaccine, I was in a car wreck, that's the vaccine's fault. Well, no, car wrecks happen. You know, heart attacks happen, strokes happen. And so there doesn't, in all the data that's been, if you try to put it all together from all these different vaccine studies, there doesn't appear to be a signal about that. But this question of splanchnic vein thrombosis, which is your intestinal vein, and the cerebral venous thrombosis, which is the ones in your head, those are much more unusual than just large veins, which like in your legs or arms. So the signal that's unusual is to see what we're doing with the AstraZeneca and the J&J vaccine in those type of blood vessels. The question then becomes, If it's higher than the rest of the population, what are the risks that cause that? Dan, I think that's the question you're asking. I think we'll know more about what those risks are in the ensuing week. And it's kind of like what we've said, sometimes we're still building the airplane while we fly it. And even though we may have more parts on it, it's not yet finished. And so I think that, I think we'll know more. We'll be able to answer that question better here within a week. And we'll take a swing at it tomorrow with Dr. McGurk too, because I think this is an area of expertise for him. I think if you look at the actual mechanism in this, this looks more like what's called heparin-induced thrombocytopenia. And I don't know that that particular disease entity, I don't believe is more common in people with thyroid disease. And I don't think it's more common in sickle cell, but I would have to double check that. Other questions? Okay. All right, well, let's talk to our guests here for just a minute, because volunteerism is incredibly important. In many ways, it is the backbone of our hospital. Our Director of Volunteer Service, Vanessa Goldsberry, again, she is going to join us, along with a volunteer, Elaine Struve. Better this time, I got the R in. So Vanessa, thanks for being with us. In general, how did COVID-19 impact the volunteer program here at KU?
Well, March of last year, we made the difficult decision to suspend the program, or what I call putting a pause on the program. And we, it's not easy to tell a great group of individuals, stay home, don't come. And so throughout the year, as the infection rate continued, we knew that there really was going to be more, well, we were thinking, actually, let me back up, we were thinking that we would perhaps open up later in the summer or into the fall, but as things continued evolving, we knew that wasn't going to happen. So, prior to COVID, we had lots of great plans, and we had recruiting opportunities and new opportunities that we were making available, and everything had to be put on pause. So it's been difficult for us, but we've pivoted on some of our programs and have done some remote opportunities, but it's been a unique year for sure.
So Vanessa, you mentioned, you and I were talking before the program, that you got here 2 months before the start of the pandemic, and so we were going to blame the pandemic on you. Is that fair?
It's definitely been a unique opportunity here, but it's been great because we have such a great group of volunteers, and any of the programs that we have that we are able to do in a more remote capacity, we've been able to do that, pivot that. So we do have some things that are continuing, just a little less traditional, but still offering those patients support from our volunteers.
And Vanessa, this whole thing about the volunteers being closed, and that's true not only KU, but throughout our community, really throughout the country.
Yes, it has impacted any nonprofit that utilizes volunteers for their services. Really have had make the same decision that we made here to put a pause on the program. So volunteers are so important because, and especially at our health system, because they offer those patient-facing opportunities that are kind of in addition to what our medical personnel do. And so when they're here, they offer that extra hand. They offer that smile, or just that ease of anxiety, and it allows our nurses and our physicians to really remain at the bedside. So it's a very important, vital program of any health system, and certainly true here. So, and all of our volunteer opportunities pre-COVID were patient-facing. So certainly our units are missing them. We are missing them in our volunteer department. So we are very much looking forward to having them come back someday, very soon.
So give us an example of some of the work the volunteers do here.
Well, pre-COVID, many of them help in the cancer center. They offer drink carts, comfort items. We have mentors, which Elaine is one of our BMT mentors, and she will talk about that here in a few minutes. But many of the inpatient volunteer opportunities were directly working with the patients, answering questions, providing comfort items, supporting our staff. And I always tell our departments when they say, well, how can we use a volunteer? And a volunteer can do anything that doesn't require a licensure or a special certification. So that's a lot of things. So many
cool
ways
stuff.
that our volunteers have supported the health system.
So, Elaine, I heard you decided to become a volunteer long before the pandemic to pay it forward. Tell us why that was important to you and what does that mean for you?
Oh, absolutely. In April of 2016, I received a bone marrow transplant at KU. I wanted to pay forward the care, concern, compassion that was shown to me by all the teams from the point of diagnosis to post-transplant. So in October of 2018, I became a volunteer in the BMT membership program. I wanted to walk the same journey with other patients to help them understand the emotional experience. So some of the minor experiences that BMT patients experience are those that now the mass populace has experienced, such as masks, frequent hand washing, sanitizing, remote working, social distancing. So hopefully all that will too come to rest soon as everyone gets vaccinated. So I thought it was very a natural fit to also decide to volunteer at the vaccination clinic.
Well, that is tremendous. Yeah. So how are you doing with your bone marrow transplant?
Excellent. I'm 5 years old.
That's good. I didn't know they turned back the clock. That's awesome.
They get 2 birthdays.
I know you do.
I get 2 birthdays.
That is great. How does volunteering make you feel?
Oh, volunteering just makes me feel so happy and rewarded. I understand that kindness is such a small gift to give, but it could mean so much more to those that are receiving.
Yeah, that is beautifully, beautifully said. You know, kindness is such a small gift, but it can mean so much more to those who are receiving it. Well, that's my thought for at least for the month. I think that's pretty darn. That's really good. So, do you have to have had a bone marrow transplant to become a volunteer?
No, well, yes, I guess you do. Only in the mentorship program. Or a caregiver.
What's the age range of volunteers and what kind of backgrounds do they have?
You're asking, that's directed to Vanessa?
Well, I was going to ask you, but I could ask Vanessa, but she'll know all the easy answers. So I was just going to try and say, are there other folks who are younger than you, older than you? I mean, is it a big range of folks?
Oh, yes. Mostly, we'll see young people. Yes, they're all ages. Yes, volunteers are welcome. They're appreciated. I know from personal experience.
Yeah, that's awesome. So, Vanessa, what is the age range? What do you have to be to be a volunteer?
Well, the age range, it kind of depends on the program, but our high school program is for any student who is going into their freshman year of high school, so 14. And then we have some volunteers who are in their 90s and close to 100.
90s,
yes.
And close to 100?
Yes.
Holy
yes,
cow.
We do.
I hope my family genes aren't that good, but man, if they are, I'll be doing that. That's awesome.
Right. Yeah. So to become a volunteer, we have an application. We do have an onboarding process, but we make it very seamless and easy because we don't want any barriers to volunteering. We want it to be a very positive experience for our volunteers because in turn, when they feel good about being here, it creates that patient experience, and happy volunteers really are a great kind of a great PR piece in our community too, because it gets them further connected with the health system, but also when they're out in the community talking with their friends or others that they know, it's a great kind of PR piece for the health system.
Yeah,
when they're
it is
satisfied.
a big deal. Well, thank you guys. Let's turn to our listening audience here for just a minute and see what questions they have, Jill.
Well, the first one is if you are volunteering in the COVID clinic and what you do in the clinic, and is there still a need?
All right, Elaine, tell us, what do you do when you're volunteering, and do you think we still need some more volunteers there in the COVID clinic?
Oh, yes. Well, I am a non-clinical volunteer. My assignments have been real compatible to the work experience that I have, organization, public relations. So the fit was just great as far as the assignment. I greet those that are the patients that are coming in. I visit with them while they're waiting in line, answer any questions that I could. If there are questions that need to be answered by the clinical staff, I make sure that that is communicated to the vaccinators. Try to make the line very efficient so that there's the least amount of wait time. And if there's clinical staff ask me for any non-clinical tasks to do, I'm more than happy to do that.
Yeah, that's awesome. So what do you, Vanessa, anything you want to add to that about what folks can do down there?
So we're also continuing to recruit for volunteers who are licensed in Kansas. Any position, clinical licensure that an individual may have that is eligible to give vaccinations. So we do have retired physicians, retired nurses, PAs, anyone who is eligible to give injections in the state of Kansas. We are looking for volunteers, and we've been so pleased at the response to our kind of call out to the community for those positions. And we have about 40 of those volunteers, both clinical like Elaine, as well as clinical volunteers. So they offer that additional support to our staff who are just working tirelessly in the vaccination clinics and giving that extra support. So we continue to recruit both clinical and non-clinical volunteers. And we have more that are onboarding now. So we've just been really, really happy with the response from the community. They've really, really stepped up and helped us with all of that. So we've
That
been
is
really
awesome.
pleased. Yeah.
I have a friend who used to work here, doesn't work in the clinical side anymore, but she has come back to volunteer for those vaccine clinics.
It's been
feels
really,
her duty, yeah.
Yeah, it's been really rewarding. And we've had several of our, I guess I would call pre-COVID volunteers, such as Elaine, they raised their hand immediately. And so we have a good group of those folks too, who just really want to continue giving back and until their traditional volunteer role within the hospital is opened back up. This is a great way for them to continue staying engaged with us and supporting our staff.
Interesting.
Simi wants to know, if you're not clinical but you want to volunteer, are there any restrictions? Do you have to be a patient? Can you live on the Missouri side?
There are no restrictions. You can live on the Missouri side. So we do have an application, and from there we just talk to you a little bit and find out what your interests are in terms of supporting in the clinic, because there are different things that our volunteers do. So we would have that conversation and then provide all the additional information to them.
And Vanessa, just as a follow-up, where are some of the furthest distances people come to volunteer? Do you have any idea?
All corners of the metro. We've got folks that come from the Northland, Blue Springs, Johnson County, Wyandotte. They really come from all over the metro to support this, and it's really just been really humbling, actually, because it's such an important piece of what we're doing to get our community healthy, and so many people just want to say, what can I do? And this is a great way for someone to give back and really help get the community healthy again.
You might even find that you have some Missouri Tiger and Kansas K-State Wildcats here volunteering.
We do. I know that we do. So,
All right,
and we welcome them.
Absolutely.
Where do you get that form, the application?
We have an online link, and it's all done online. So perhaps we can put that up on our website and in our Facebook post.
We can. What is it? Do you know what it is? No.
I would have to get it. It's a special link that leads directly into our
I bet you could
applications.
We should have gotten that ahead
I
of
bet you
time.
could Google KU Hospital volunteering and find it.
There is a link
team's trying
from
to do
our
that.
page. There is a link from our page on the website, on
Okay.
the KU website.
Uh-huh.
But I wouldn't be able to specifically say exactly what the link is, but you can search for that on our website, and it will be in there.
All right.
Other questions?
Yes, Judy wants to know, this is going to
All of us,
non-topic
yeah.
questions. She wants to know if you can tell her the ages of some of the people that are in the hospital right now.
No,
Hawkeye?
I don't have that. We can easily get that
we'll have
from
it
David
tomorrow.
Wild or Amanda Cackler.
Yeah, we can get
there's-
it tomorrow. I think it's the overall age has shifted downward a little bit, but it's still predominantly, a little older. But as people get vaccinated, the ones who are coming to the hospital, the unvaccinated, which tends to be a little bit of a younger age population.
Yeah,
So-
last time
and that's true
David-
nationally too.
Yeah, last time Dr. Wild was on, he mentioned that we had at least a couple that were even in their
Yeah.
20s.
Yeah, that's what's going to happen because the numbers are not 250 anymore, right? They're less than 20. And so what that means is that because of vaccine and people who have had disease and good infection control precautions, that really what we're seeing is that people who are a little bit younger are coming into the hospital because they tend to be less likely to be vaccinated.
Shannon wants to know, with schools removing mask mandates, what are your thoughts about the safety of children?
So, we talked with the school districts last week,
Yeah.
and I think we have to wait and see those mask mandates come all the way off. It makes me a little nervous to not have masking in big public spaces with lots of people, just because the variants are out there, especially the ones that are called, the British variant or what have you. And Hawk, I think that we still know in an unvaccinated population they can still spread the virus, and the problem with spreading the virus is not only can you infect people who have not been vaccinated and they get sick, really sick, but also you give the chance for the virus to mutate again, and you prolong this public health crisis. So I'm a little nervous about the whole masking thing. How about you?
Yeah, I mean, I think the data would show that schools really have not been, for the most part, places where there's a lot of spread, a lot of outbreaks. But we have to remember, and if you look at those articles that studied that, in their discussion, they all mention, well, this is because masking is still going on. Distancing as much as possible. We know that now there is less distancing that is required, that 3 feet compared to that 6 feet initially. But if you, number one, are having more kids packed together, closer together without masks, I think that's dangerous. And again, the information that we do have that shows that schools are not as likely a place to spread or create the outbreaks is because of distancing as much as possible. Also, the masking is going on in those studies as well. So I think all of that helps to contribute to the decreased or the low amount of spread we saw in schools. I think if you remove masks, those data points are no longer valid, and I think you do have a higher risk of spread, especially when they are so close together for such a long time, essentially.
Hey, you might be able to see now, it just popped up, and I just Googled it myself, showing that I'm still electronically literate, and found the same website almost as fast as Logan. He had a head start. But it does show where you can go register to become a volunteer here at KU. You can read through all the information that's out there, and it really is the University of Kansas Health System.com. But if you just say KU Hospital volunteer, it'll take you right up there, and you'll find it. So there you go.
We've also posted it in the chat on Facebook, so to make it easy. Jennifer wants to know, can fully vaccinated high school students volunteer this summer? Do you have to be fully vaccinated to volunteer?
Right now, we're not requiring our volunteers to be fully vaccinated while we're still in that EUA with the vaccines.
And so what was saying that because it's not a fully approved FDA drug, just as we're not requiring our own staff, we're not requiring the volunteer staff either, but you'd offer it to them.
That's right, absolutely. Yes, we would offer that. So with our vaccination clinics continuing and ongoing, we anticipate that this will likely go through the summer into the fall. I think, that crystal ball that we all talk about, it's not real clear right now, but anyone who is 16 and over is welcome to apply and be part of that vaccination clinic. So I know a lot of high school students are looking for volunteer hours. A lot of our opportunities, of course, have been put on pause for the last year. So it would be a great opportunity for high school students 16 and over to be a part of that. And it's a very unique opportunity. So we would encourage that.
Terry's asking, are volunteers just at the hospital, or are there volunteers at other locations?
So right now, we do not have any volunteers that are in the hospital. All of our volunteers who are coming in person are supporting the vaccination clinics. Once we have indicators that will be safe for our volunteers to return to campus, they will be not only at our main hospital here, but also our cancer center, Westwood, various locations throughout the metro.
And clinics as well. It's not just
clinics.
hospital, but clinics. I know
Yes.
we use the volunteers are great to have.
Yes,
on the clinic.
absolutely.
That's a great question.
Yep.
Okay, Paula wants to know, She says, good morning, doctors. Can monoclonal antibody treatment be used in children?
Yes. I think the age for monoclonal antibody treatment is 12 and up, as long as they're 40 kilos or more, 40 kilograms. So, yeah.
Which is about 88 pounds,
something
90
pounds, yeah.
88, I think.
Okay. Christy wants to know, can you speak to the latest research on children under 16 and the new variants? Does the research show these variants have a harsher effects on this age group? Is it spreading faster?
Great questions. Jill, when is Children's back with us again?
Yeah.
On May
don't-
13.
Awesome. We may need to get them sooner. Holy cow.
Yeah, I don't know anything specific as far as published data. I know that there's a lot of articles out there in the media just about younger people being infected more, and also younger people, but this is not children, this is 18 to 30 or 18 to 40, being more affected for one reason or another and going to the hospital. So I don't have all the data, and I don't know if there's a lot of published information specifically on pediatrics and the variants.
Yeah, I've not seen it either. And the only thing I know as far as vaccine effectiveness comes out of Israel, and that was they had a lot of Pfizer vaccines, so I think they went down to 16 years of age, but I don't know the details about that specifically. Man, we've had a couple of I don't knows this morning, Hawkeye. We're going to have to keep working on the airplane a little bit more.
Lindsay wants to know, are you seeing anyone vaccinated that's in the hospital? We get that question a lot.
It's really, really rare. And we do see patients coming in who are vaccinated, but they're usually here for other reasons. Like we'll find somebody who has been vaccinated, they're here for surgery, and incidentally, they test positive for COVID-19. Now, they're asymptomatic. We haven't really hospitalized many folks at all post-vaccination who are coming in the hospital with COVID-19 and being treated for COVID-19 as opposed to something different than that.
Yeah, you know, I think a week or week and a half ago, we had 3 patients that we knew that were admitted to the hospital. 2 were found positive on admission screen, but were not symptomatic. 1 was symptomatic, but it's not really clear that that patient was here for the symptoms. It certainly could have been something else. We don't have a full system in place to identify those patients yet within our electronic medical record or questionnaire or screening, but we are working on getting that. So we're still.
Remember, it was a 95% reduction in hospitalization and death, I think, which is still pretty darn impressive.
Yeah, and I think especially for our nursing home population, we haven't seen really any nursing home.
Oh gosh, the nursing home population, who I think is the most vulnerable post-vaccination, those patients have just, they reached
disappeared
anyway. It's disappeared, which is why our hospitalization numbers in part are so low, along with anyone over the age of 60.
But we are certainly working to identify those patients that have been fully vaccinated.
The hard part is trying to make sure that you know that because you're positive with COVID-19 and you've had a vaccine and you're hospitalized, does the reason for hospitalization link at all to COVID-19 or to the vaccination? And that's something we really do research pretty carefully on anybody, because we still test every single patient to see if they've had COVID or they have COVID-19 when they are admitted. And we're just, again, the numbers you hear, the numbers are really low right now. They're down by 90%. And I think a lot of that has to do with the fact that over 50% of people across the country are getting their first vaccine.
Catherine's asking if we are sequencing those that are hospitalized for the variants.
Yeah, if there's any suspicion, we send it out to the state lab.
Yeah, we do. We exactly. You know, we do have protocols in place to identify people we think may, but it's not everybody that comes in. Especially if they came in, they said, well, I had it back in November, I had COVID-19. Now maybe they're back in for one reason or another, or sometimes if they are fully vaccinated. So we have those things. And there could be other reasons that they are sent for sequencing, just general surveillance. But we have sent some isolates off to the state lab.
Rebecca is asking, can we talk about the rise in infection in kids and the risk of, and she writes all in caps, Miss-C?
Miss C,
yeah.
That's the inflammatory syndrome that happens with children, Hawk. And one thing we know is we're seeing a rise, especially in younger people, of long-haul syndrome, whether or not they were symptomatic with COVID-19 or very symptomatic with COVID-19. The long-haul syndrome is something that is not just in the elderly. Actually occurs a lot in younger people as well.
Yeah, and I think this was one point I was going to talk about on that earlier question about the variants in pediatrics. Even before the variants were starting to surge more, like the Michigan surge, and we knew that the variant, especially this UK variant, was becoming more prevalent in the United States. Even before that, there were reports out that there were larger numbers of the multi-system inflammatory process going on in those pediatric patients. Even though it's a very small number, you certainly don't want it to happen to your child or your grandchild. So we know that that inflammatory process does happen. We know that they were seeing more, and I think that is just a reflection of the spread in the kids. And again, it may not necessarily be in schools, because for the most part, since schools have reopened back up, they have tried to maintain the distance. They have been doing masking. But it's those things outside of school, and it's getting together in areas or parties outside of school, I think because of the overall nature of the COVID weariness and wanting to get back to doing things. So we know that there is a probably higher spread, or actually more identification of these, number one, cases in children, but also the multi-system inflammatory process.
Stacy's wanting to know if we think the vaccine works against the variants.
We do think the vaccine works against the variant. More and more data is proving that. The only one that was in any doubt really is the 351 out of South Africa. But even there, it shows significant impact with Moderna and Pfizer. Maybe not quite as good with AstraZeneca. I think J&J is going to land in between those.
Yeah, no, I think you're exactly right. The early data based on clinical data, real-life experience, particularly the Israeli experience, also some of the FDA approval documents that were done, particularly by Johnson & Johnson, against the the South African variant, 351. But also some laboratory data now is showing that you can still get fairly good immunity for these variants. And I think the most concerning one is that South African variant, the B1351. And it's not just because of the antibodies that you create, but it's also those T-cell responses that are created by the vaccine. So right now, it's not fully 100% compared to the original, say, Wuhan strain that the vaccines were made against. But they do have efficacy, and they do provide protection.
And they do appear to prevent hospitalization and death. You may get a little bit sicker, but again, you have a bad cold as opposed to being in the hospital. Okay, that's good. Let's get the vaccine and make sure you protect yourself.
And from what we understand, the vaccine companies are trying to pivot to use, maybe the spike protein from that South African variant. It may be a booster shot coming down the line. So.
And we think that booster may come out probably into the late fall, early winter, and it will have the alterations in it, which Pfizer and Moderna can pivot really quickly. I think Novavax is going to be able to pivot when it becomes available, hopefully here in the next few weeks. Those will be able to pivot relatively fast. A little longer to get the J&J and AstraZeneca ones up to pivot like that. But remember, there's a lot more vaccines in the pipeline too. We talk about these as if they're the only 4 vaccines out there, and then we talk about Novavax number 5. But there are a number of other vaccines out there that are going to come out soon too.
Yeah, and I'm hoping eventually, maybe you can have 2 or 3 or 4 different spike proteins in these vaccines to account for a lot of these variants. But also understand that there are conserved regions. There are regions that are the same on that spike protein that still can elicit an immune response and give you protection.
Yeah, one change in the spike protein does not negate the ability of the vaccine to go after it, because here's your point. There are conserved regions that the vaccine can then go after with their antibody response.
Okay, last question goes to Diane this morning. Have you found any cases of patients being admitted for more than one episode of COVID infection? Not the same infection, not twice for the same infection, but you got it.
Yeah,
there are reports of that going throughout the country. Yes.
Yeah, I saw one last week.
Yeah.
So, and that patient actually got the isolate sent off. But just, we've seen it. I don't have all the data of all the people that we've seen, but certainly anecdotally, I did see one last week while on the floor.
And was that patient better or worse the second time around?
Patient was hospitalized this time, which was the second time, but the first time felt really bad. It was really about the same sort of illness, really. Did not stay here very long at all. After a couple days, felt a lot better. So
Vaccinated?
She was less than a week from her vaccine dose when she developed symptoms, I believe.
Not much. So,
and that was the first vaccine dose.
Other interesting things that came out this weekend is if you get one vaccine and you've had COVID, you seem to have higher antibodies than people who just get their double dose. And so that, it really does. I mean, if you've had COVID and you get vaccinated, you should have higher antibody levels.
Yeah.
That makes people ask, do you need the second shot? We've had that a lot. So
Yeah,
what are your thoughts on that?
well, no, you clearly need this. Well, for COVID positive patients, we are recommending the second shot to make sure that you have the full boost to all aspects of your immune system.
Yeah.
We don't know the complete answer to that, but we're going to act in the best interest of science, I think.
Yeah, and I know that question is being asked right now, and hopefully we will get an answer. But really, once you get that boost, it really helps to further increase that immune response, that specific immune response to the spike protein. So yeah, but I believe this patient was, I would say, when she started getting symptoms, less than a week from that first dose. And I did recommend that once the second dose is scheduled, and she should go get that second dose as well to stay on.
All right, so, we've had some great questions today. I think these people are graduates of our program. What do you think?
Yeah,
They've been
that's
listening
right.
for a long time. They've got their degrees. Hey, tomorrow, though, it'll be an amazing program, a great discussion with two brilliant experts. The pandemic has been challenging for cancer patients as they navigate treatment and the best time to get vaccinated. Especially this has been true for those who have had blood and bone marrow cancer. Dr. Joe McGurk, the Division Director for Hematologic Malignancies and Cellular Therapeutics. That's a big mouthful.
Say it in one breath.
Yeah, I did, but barely. Medical Director of the Bone and Blood and Marrow Transplant Program here at the University of Kansas Cancer Center. He will be on, along with Dr. Ala Ola Abdallah, the Director of Plasma Cell Disorders here at the University of Kansas Cancer Center. These are pretty remarkable folks and really brilliant. You're going to enjoy listening to them. They're going to talk to us about how the pandemic is impacting their patients and also introduce you to the first two patients to receive the newly FDA-approved CAR T therapy. That's also a mouthful, CAR T therapy for multiple myeloma. That is a remarkable development. Tomorrow is going to be a heartwarming and inspiring discussion. Don't miss that. Final thoughts. First, Vanessa.
Well, really appreciate the opportunity to come on this morning and talk a little bit about our volunteer program. It is National Volunteer Appreciation Week, so encourage anyone who works with volunteers or has volunteers supporting them, especially in our vaccination clinics, to thank them for all of their hard work. And I did want to add, I do believe we have some Facebook posts this week that will have that link as well to the application. So that will be another way for them to, for anyone who's interested in volunteering with us, to join our efforts. So thank you for having us.
Well, thank you, Elaine. Thank you for being here. You're the best. Thanks for being a volunteer here and doing it after a bone and marrow transplant. You probably know Dr. Joseph McGurk pretty well, I'm going to bet. But
Yes, in the teams, yes.
yeah. Well, thank you. Final thoughts from you today.
Oh, I am so grateful and humbled to have the opportunity to volunteer, and a big thanks to the medical community for your tireless work. Thank you.
Well, thanks to all the volunteers who help us get that work done, because it takes a team, it takes a village, it takes all of us to get that done. Hawkeye, final thoughts.
Yeah, I mean, Joel McGurk is extremely bright and smart, so he needs a lot of words behind his name for
Yes,
that.
he does.
But, again, we'll try to get some information about the ages. I know those are questions asked, and very good questions about the vaccines. We do believe that the vaccines continue to provide very good efficacy against hospitalization, severe disease, and death, even for those variants. So, we'll continue to work on vaccine hesitancy. Everybody should be out there, if you're 16 above, getting the vaccine. That is how we are going to be getting out of this pandemic and working towards reduction in restrictions as we move into the spring and the summer, and then again, hopefully, Arrowhead in the fall.
Man, I can't wait. Let's go Royals.
Yeah.
Let's go Chiefs. Let's go. Hey, we've talked a lot about on this program faith, hope, and science, and how faith and our ability to take care of each other and our faith sustains us. Hope that we can have the things delivered to us that we have lost through science. The science is real, and the science is successful. There's only one way to get ourselves fully out of this pandemic, and that's for all of you to find one more characteristic, and that characteristic is believe. You have to believe in the science and become vaccinated. It warms my heart to see more Americans starting to get vaccinated and vaccine hesitancy beginning to drop, and for America to be making a comeback and rapidly rising to being one of the top vaccinators in the world. That is a remarkable statement from where we've come. It takes all of us to do it. Faith, hope, science, and belief. Together, we can. We'll see you tomorrow.